Imagine this. You look at the face of someone close to you, and you can't make it out. You see their hair, shoulders, the outline of their figure, but where their face should be, a blurry spot. You see everything around it except what you're looking at directly. This isn't fiction or a rare nightmare. This is how the world looks with macular degeneration, a disease that destroys central vision. And the most alarming part, it's one of the leading causes of irreversible vision loss in people over 50 worldwide. But here's what's important to understand from the start. A person with macular degeneration doesn't go completely blind. Peripheral vision is preserved. But the most valuable thing is lost: the ability to read, recognize faces, drive, and distinguish detail. The things without which everyday life becomes something else entirely. Today we'll cover everything. What the macula is, why it deteriorates, what forms exist, how to recognize it early, and what can genuinely be done. To understand the disease, you need to understand one small but critically important part of the eye: the macula. The retina is the light-sensitive layer up the back of the eye. The macula is its central zone, only a few millimeters in size, a tiny point, but it's responsible for central, the sharpest vision. When you read these lines, recognize a face, thread a needle, make out a bus number, the macula is working. The rest of the retina provides peripheral vision. It sees movement, shapes, light at the edges, but detail, sharpness, color in the center of the visual field, that's the macula's work. The macula contains an enormous number of special cells, cones, responsible for sharpness and color perception. It's the most loaded part of the retina, and that's exactly why it's most vulnerable to age-related changes and nutritional disruption. When the macula is damaged, it's the center of vision that suffers. A person looks directly at an object and doesn't see it clearly. Meanwhile, peripheral vision remains intact. This is the characteristic picture of macular degeneration. Macular degeneration comes in two main forms, and the distinction between them is fundamentally important. The dry form is more common, accounting for the majority of cases. It develops slowly, gradually, over many years. In this form, metabolic byproducts accumulate in the macula, drusen, small yellowish deposits. Over time, the cells of the macula thin out, their function declines. Vision deteriorates gradually. A person may not notice significant changes for years. The dry form doesn't lead to sudden vision loss, but it can slowly progress and in some cases transition into the wet form. The wet form is less common, but significantly more dangerous. In it, abnormal blood vessels begin growing beneath the macula. These vessels are fragile. They leak fluid and blood, causing swelling and damage to the macula. Vision in the wet form can deteriorate very rapidly, sometimes over weeks or even days. It's the wet form that most often leads to severe loss of central vision. Understanding the form is critically important because the approach depends on it. The wet form requires urgent intervention, and time plays a decisive role here. The symptoms of macular degeneration are linked specifically to central vision, and this helps recognize them. The first and one of the most characteristic signs: distortion of straight lines. A door frame, the edge of a table, lines on a sheet of paper suddenly appear wavy, bent. This is called metamorphopsia, and it's an important early signal. The second sign, a blurry or dark spot in the center of the visual field. A person looks at an object, and right in the center, the image is unclear, dim, or entirely absent. The edges, meanwhile, look normal. The third, difficulty reading. Letters blur, drop out of the line. A gap appears in the center of the text. You have to move your eyes to catch a word with peripheral vision. The fourth, reduced brightness and saturation of colors. The world becomes a little dimmer, colors less vivid. The fifth, a need for brighter lighting for the same tasks that used to be done in a normal light. An important nuance. In the early stage, especially when one eye is affected, a person may not notice the problem at all. The healthy eye compensates, and the brain fills in the picture. That's why changes are often discovered by chance, when a person covers the healthy eye and suddenly realizes the other one sees poorly. Macular degeneration doesn't develop in everyone, but there are factors that significantly increase the likelihood. The main factor is age. Risk rises significantly after 50, and the older a person is, the higher the probability. That's exactly why the full name of this disease is age-related macular degeneration. The second factor is heredity. If close relatives had macular degeneration, the risk is higher. Genetic predisposition plays a substantial role. The third, smoking. This is one of the most significant modifiable risk factors. Smoking multiplies the likelihood of developing macular degeneration and accelerates its progression. The fourth, cardiovascular disease, high blood pressure, high cholesterol. Everything that disrupts blood supply also affects the nourishment of the macula. The fifth, prolonged ultraviolet exposure without eye protection. The sixth, dietary factors. A deficiency of certain substances, antioxidants, vitamins important for retinal health, can play a role. If I go blind from macular degeneration, it'll be total. This is incorrect. Macular degeneration affects central vision, but peripheral vision is preserved. A person isn't left in complete darkness, but loses the ability to read and recognize detail. It's a different type of vision loss than with other diseases. It's just old age. Nothing can be done. This is a dangerous misconception. In the wet form, methods exist that can stop progression and preserve vision. In the dry form, the right approach and monitoring help slow the process. Inaction is the worst choice. Glasses will help. Glasses correct the refraction of light but don't affect the condition of the macula. With macular degeneration, the problem isn't focusing. It's damage to the light-sensitive tissue itself. Glasses aren't the solution here. If nothing hurts, everything's fine. Macular degeneration causes no pain. It manifests only through changes in vision. The absence of pain says nothing about the state of the macula. Let's start with the most important: early diagnosis. The earlier macular degeneration is detected, especially the wet form, the greater the chance of preserving vision. This is the core principle. In the wet form, intravitreal injections are used, administering special medications directly into the eye cavity. These drugs suppress the growth of abnormal vessels, reduce swelling, and can stabilize and sometimes improve vision. The procedure is performed under local anesthesia. Often, a course of injections with regular monitoring is required. This sounds serious, but it's exactly this method that changed the prognosis for the wet form. What once led to blindness can today, in many cases, be stopped. In the dry form, there is no specific treatment yet that fully stops the process, but there are approaches that help slow progression. These include special vitamin-mineral complexes for retinal health prescribed by a doctor, control of risk factors, quitting smoking, ultraviolet protection, and regular monitoring. An important part of management is self-monitoring. There's a simple way to track the state of central vision at home: the Amsler grid test. This is a special grid, looking at which a person can notice distortions of lines or the appearance of spots. The doctor explains how to use it, and if changes appear, you need to contact a specialist immediately. For people with already reduced central vision, assistive aids exist: magnifying devices, special lighting, technologies that help read and navigate using preserved peripheral vision. If you're over 50, a regular fundus examination should become part of your healthcare. The macula is checked during a dilated pupil examination, and this allows early changes to be detected before they become noticeable. If you've noticed distortion of straight lines, a spot in the center of vision, difficulty reading, or a decline in color perception, don't delay. This is reason for urgent attention, especially if the changes appeared rapidly. If you have risk factors, heredity, smoking, cardiovascular disease, examinations should be regular even in the absence of symptoms. And separately, if macular degeneration has already been detected in one eye, the other eye requires special attention and regular monitoring. Macular degeneration is a serious disease that takes the most valuable thing in vision: its center, its sharpness. But it isn't a sentence. With early diagnosis, especially of the wet form, modern methods make it possible to preserve vision in many cases. And with the dry form, timely monitoring and control of risk factors help slow the process. The key here is not missing the moment. The macula doesn't hurt and gives no obvious signals in the early stage. The only way to catch changes in time is regular examination and attention to your vision. If you're over 50, if macular degeneration ran in your family, or if you've noticed any changes in central vision, come in for an examination at Ko'z Nuri Clinic. We perform dilated fundus examinations, optical coherence tomography of the macula, and a complete assessment of retinal condition. After the examination, you'll know exactly the state of your macula and what needs to be done next. Contact details and booking are in the description below.